Exercise testing is very important, and this can be done either maximally or submaximally. Maximally means taking the person to the point where they can no longer maintain the intensity levels. This is what happens when lactate starts to accumulate excessively, and the TCA cycle can no longer process pyruvate, the pH balance of the body changes, fatigue sets in, and exercise ceases. Maximal testing isn't always feasible or applicable to a situation. Submaximal testing is designed to determine your heart rate response to the given work in order to predict your VO2. Remember those earlier graphs we looked at that plotted exercise intensity and heart rate. Maximal exercise is the best assessment of safety for exercise and the presence of possible disease. Maximal exercise testing also gives you the best data. It'll give you a true maximal heart rate that you can use for your exercise prescription purposes. Submaximal testing, however, takes less time to perform. It's less expensive and doesn't require a physician to supervise it. It is also safer to do in those individuals that you know they have an established disease. Now we can do testing through direct measures, as seen here on a treadmill, 12 EKGs, and collection of oxygen. We can also do it estimated. We can have someone go around the track a number of times, calculate the time that it took them to do that, maybe use their heart rate and estimate VO2. This is similar to the 1.5 mile run that you do. We can also perform testing in a lab, or we can perform it on a field. These are the same measures, but here you can see a golf cart is being driven alongside of an athlete who is having their oxygen measured by this big bag. When you're determining whether you want to do a maximal or a submaximal test, it's important to think, what's the length of the test? Submaximal is typically shorter. How willing is the participant to go to complete exhaustion? If they don't want to end up on the floor, a maximal test won't be recommended. Cost. Maximal testing or collection of gases is very expensive. The personnel needs. As I said, maximal tests usually require the presence of a physician. And what are the equipment and facility needs? Maybe you're at a school and all you have is a track. You don't have comprehensive treadmills and oxygen consumption equipment, and so then your decision is made for you. Now, getting into an aerobic test, there's a number of pre-test instructions that people have to follow. Before an aerobic endurance test, even the 1.5 mile run, you shouldn't eat for 3 to 4 hours. However, if you are prone to hypoglycemia, low blood sugar, it may be advised to have a light or healthy snack of a protein-carbohydrate mix, a combination of 2 to 3 hours. Other than that, no eating. We also don't want any strenuous exercise in the 24 hours before the test. We want our athletes fresh for the testing experience. No caffeine. No caffeine containing products 12 to 24 hours before the test. Caffeine is a known ergogenic aid. It improves aerobic performance when taken in a high enough dose. No nicotine for at least 3 hours, and no alcohol for at least 24 hours before the test. You should consult your test administrator or physician for advice on using medications before the test, if you typically use medications. We do encourage that all of our testees should be encouraged to eat something lightly and well balanced in the 12 hours preceding the 4-hour pre-test fast. There are 4 primary purposes for maximal exercise testing. 1, screening for the presence of disease, if we don't know if disease is present. 2, diagnosis of the disease when the symptoms are present. 3, the prognosis of the patient relative to CAD and or other cardiac history. So where are they in the stage of disease? And then 4, for the use of an exercise prescription. So you can see that most of the reasons for doing a graded exercise test are related to disease or medical problems. Now, who should have a maximal graded exercise test? Well, we should have it in those with a moderate to high disease risk, older or diseased individuals wishing to perform high-intensity exercise, such as masters competitions, those with symptoms that may suggest disease, and high-performance athletes, Ironmen, marathon runners, etc. Now, personnel-wise, you can see here, we need test administrators. We may need a physician nearby in the room. Allied healthcare personnel, including exercise physiologists or nurses who have been trained adequately in performing exercise testing, are useful. Now, the protocols for exercise testing should be based on the purpose of the test, the type of exercise, and the population being tested. There's going to be a difference when testing old versus young athletes, and there will also be differences testing athletes who prefer to ride a bike, maybe row, or even skate at this point. You can see this large treadmill that mimics skiing that we can put uphill, downhill, etc. So based on the exercise activity that the person you're testing does, we want to match that. If they're a walker, we put them on a treadmill. If they're a runner, we put them on a treadmill running. If they're a cyclist, we put them on a stationary bike, and vice versa, all the way down. Now, what do we do during an exercise test? Well, we take a number of measurements. Common variables include heart rate. We'll use a metronome, we can use the phone, we can use a heart rate monitor, we can hook them up to an EKG machine to get this reading. We're also going to take blood pressure. We may take a rating of perceived exertion, anywhere from 6 to 20 on this Borg scale. We will also use subjective measurements of signs or symptoms related to coronary ischemia. Are they having heart problems? Are they feeling chest pain? We're also going to take direct measurements of oxygen in and CO2 out. This is our ventilatory response and expired gases. Once we get all of this data, we can interpret the results using age, gender-based normative data based on what testing method we used. Was it treadmill, cycle, rowing, etc.? Remember, the graded exercise test is the best test for establishing a true cardiorespiratory fitness.